And with that, we are all set to proceed forward our next session. Well, the topic is happiness a choice? Unveiling attitude of the Garden of Joy. And to do the honor, allow me to introduce you all with Dr. Peter. Well, Dr. Peter is a very famous psychiatrist, and he has joined us here all the way from New York. Well, that's definitely been a long flight, but we are honored to have him here with us. Well, he is very passionate to bring effective holistic healing to the practice of mental health. And apart from that, he has written a number of textbooks, books, and a number of papers on the topics. Well, his newest text for practitioners is Holistic Solution for Anxiety and Depression, which is published by Norton, and we can't be more than honored to have you here with us. Please give it up for the gentleman, everyone.
And thank you, Dr. Sanjay, for the invite. Anyone needs a stretch or big breath? Feels good. All right. All right, so we're going to talk about mental health and longevity. And I practice in New York. I've been in practice for about 20 years as a naturopathic doctor and also an acupuncturist there. Does anyone do acupuncture here? A couple, great. So how many people are health practitioners? How many people practice health? Okay, great, so few, wonderful. Okay, so what am I going to talk about today? How psychiatric illness affects longevity, the underlying causes, and what we can do about it. So Shakespeare, who wrote in the 1800s, one of his famous quotes is, "A merry heart goes all the day, but a sad heart tires in a mile." Right? So he knew way back when that when you're not happy, it's very hard to be healthy. When you don't feel good about your life, and you don't feel passionate about your life, it's very hard to be happy, right? Sri Shadhalu Ranade spoke earlier and so eloquently about how the spirit affects the mind and how the mind affects the body. In my opinion, that's the most powerful way. That's probably not what I'm really going to focus on today. I'm going to focus on more of the physiology. But if we don't have the mind, right, if we don't have the spirit and the soul supporting the mind, of course, the body's going to suffer. But we're going to kind of look at it from the other direction and look at it in the sense of how when our physiology is in imbalance, how that's also going to really affect our mind and eventually our spirit. Or though not our soul, right? I don't think we could change that. Okay, so some mental health statistics. There's been, in the United States, a 50% increase in mental health issues, and that's up to 2019. So that doesn't include COVID. Since COVID, it's skyrocketed. I can't tell you how busy my practice in New York is since COVID. So from a business perspective, wonderful. From a health perspective, awful. There's so much to be done, and there are not enough practitioners to do it. 14% of global deaths are due to mental health problems, about 8 million people, and 50% of all people affected by a mental health challenge during their lifetime globally. Now, there's some studies that were recently done that showed that in older people who have depressed brains, their brains actually look 4 years older. The brains are atrophied, and they have the hallmarks of looking older: inflammation, a lot of cortisol damage in there as well. So in India, actually, it seems like you guys are doing a very good job here. India was among one of the first countries in Southeast Asia to have a dedicated mental health program. And it looks like from a mental health perspective, it's around 14%. And I know in the States, it's around 25%. So certainly more to be done, no question about it, given the population size. But really, it's being somewhat, addressed, which is great. There was an abstract presented in the Paris Symposium in March 2023, and it says people who have mental health problems have bodies that seem older than people who do not. So there's some literature that showed that. And that psychiatric illness showed a 10-year decrease in life expectancy in men and a 7-year decrease in life expectancy in women. And we saw Dr. Tang earlier today in his wonderful presentation, really enjoyed it. from a Singapore research article in, I think it was 2018, that showed that people who are happier live longer. So this is certainly consistent with that data, right? Anxious individuals had almost a 40% greater risk of dying earlier than people who are not anxious. I myself, who's experienced anxiety, knows what it feels like, and there are many reasons for that, and we're going to tell you why people tend to not live as long. So when we think about symptoms, right, symptoms are really the tip of the iceberg, right? We have, whether it's anxiety, depression, mood issues, it could be schizophrenia, it could be bipolarity, all these different conditions that we experience as a population are the symptoms. And I know where I live and where I practice, conventional psychiatry looks at symptoms and says, okay, you know, your mood is low. Let's give you a drug. And sometimes it helps, right? 35% of people, that could help people with depression. But even when it helps, it's not fixing the problem. And in general, people who take drugs over time tend to not learn how to cope, not learn how to fix their problems. And I see this over time. The drugs at one point stop working, and people, or they have to get off the drug because of some side effect, maybe it's weight gain or other issues, right? Weight gain, which predisposes to metabolic issues, which predisposes to less longevity. So what happens? They get off the medication, and I'll give you an example. I had a woman who came to my practice a couple of years ago, and I remember this. She had gotten divorced 10 years ago, was very sad, got put on antidepressants, felt better, ended up marrying somebody else, very happy in her life now, had to get off the medication, and when she got off it, she started going through all the feelings of her depression. Now, why was that? That was because she never went through it really the first time, right? Those medications, they can be helpful, and maybe in an urgent situation, when somebody's trying to hurt themselves or hurt somebody else, sometimes they can be life-saving. So I'm not saying we should never use them, but when we use them and use them and use them and use them and don't look at the underlying issues, we just look at the tip of the iceberg, eventually that's going to be a problem. So what are the underlying causes? So there's a whole bunch. You know, when we're stressed out, when we're not living the life maybe we want to be living, and we fear that there's a bear coming at us all the time, we're going to be stressed out. Cortisol is a stress hormone which is going to go up, which I'll talk about in a second. It bathes our brain and beats it up, and our brain doesn't work as well. Inflammation, right? When cortisol gets dysregulated, inflammation goes up. I heard talk about telomeres before. We'll talk about that in a second. In terms of longevity, of course, poor nutrition, blood sugar imbalances, a lack of exercise, not sleeping enough or maybe not sleeping well, imbalanced hormones, sorry about that, mitochondrial problems, which we just heard a fine lecture on, environmental toxicities, and genetic predisposition. So all of those things, when I work with a patient and they come into my office for the first time, my visit is about an hour and a half, and I sit down and I really try to get to know my patient, and we try to talk about all these things because I need to understand, okay, this person has anxiety, they have depression, but which one of these factors are the reason? Is it 5 of them? Is it 10 of them? Are there even more than that? What's the reason a person has depression? And what specific recommendations can I give them to start to address as many of these as possible? Sometimes I don't know them all. Right? Doctors don't know that much about the body. The body has so much wisdom that we don't remotely understand. But one thing I've learned in 20 years of working with patients with mental health issues is if we address as many of these as possible, then usually we're giving the body the best chance to start figuring it out and healing. So just very quickly, so cortisol. So the 3 things that we're going to talk about up there are cortisol, inflammation, and telomere destruction. Very briefly. So cortisol is a stress hormone that goes up when you're running from a bear. It bathes your brain, and one of the things it does is it gets blood sugar going, and it gets your body ready to fight that bear, right? The problem is when cortisol's up all the time, it beats your brain up. Your brain actually starts to atrophy. And we know that people who have high cortisol levels end up having a lot more cognitive dysfunction, is much more predisposed to Alzheimer's, much higher risk of diabetes, much higher risk of cardiovascular disease, and so on and so forth. So that's one. The second is inflammation. When cortisol gets dysregulated and it doesn't work so well, the body stops listening to it. Cortisol is one of the main stress hormones that helps keep inflammation down. So when this starts to get dysregulated, inflammation over the long term goes up. And you know what's interesting to me? Cortisol and inflammation in the short term, for the right reasons, is actually good for your body. It helps you get past a difficult time. The problem is we tend to keep injuring our body, or we keep staying stressed out, and these things that are good in the short term are not so good in the long term. And then the third thing is telomere destruction. When there's a lot of inflammation, for example, and the body's out of balance, those little, and I think it was, I forget who described this before, Dr. Aluk, I think, described it before. I love that he used the same analogy I have. This is one of my shoelaces, right? And when the shoelace has a cap on it, it's protected and it doesn't fray. That's called an aglet. When the shoelace doesn't have a cap on it, it frays. That's the same with DNA. DNA telomeres are basically these little caps on the DNA that keep it protected. So when we don't have that protection, our longevity goes down because the DNA gets beat up, and the DNA are our blueprints, right, that tells our body how to build things properly. So what are the things that lower telomere longevity? Inflammation, early life stress. When a child gets yelled at a lot, that's been shown to lower telomeres. Low vitamin D, poor nutrition. So all the things that we know aren't good for us, we know also affect telomeres, and environmental toxins. So all of the things we know are going to affect eventually our longevity. So I talked a little bit about conventional drugs, and I think we decided that conventional drugs, although sometimes life-saving in the short term, are actually not a great choice in the long term to work on mental health. What I didn't mention is that sleeping pills are one of the biggest culprits and kill hundreds of thousands of people a year in the UK alone. And that's not even using them every day. That's using them once or twice a month. 300 to 500% increase in death risk from using sleeping pills when you take out other confounding factors like sleeping. Now, I don't know about here. In the US, they don't talk about that in the news, right? If there's a drug that increases, the risk of dying from cancer, increases that you get maybe a month extra and costs $20,000, they'll talk about that. But they don't talk about things like this. So if drugs aren't the answer, what can we do? What else is out there? And I think you've heard probably most of it, if not all of it already. We know that 70% of disease and aging isn't really due to our genetics. That years ago, we used to think you get handed a deck of cards, and if you're going to get cancer at 50, you're going to get cancer. Well, what we've learned is that we actually control a lot of those cards that we're being given to. So what are the controls? Sleep, moving our bodies, environmental toxicity control, getting into nature, educating ourselves, drinking enough water, food, and the right supplements. So we'll go through each of them briefly with the time we have. So sleep. And I chose these because the things I'm going to talk about are also proven to increase longevity and are proven to either prevent and or treat mental health issues. So sleep. There's studies from 2014 that show that when you get enough sleep, you live longer. Very simple. So many of us just don't get enough sleep. But if we do the right sleep rituals, we stop the screens beforehand, we get to bed on time, we have a nice dark room, hopefully not too warm a room, we get enough sleep, it rejuvenates our body. That's when our body detoxes. That's when the mitochondria fix themselves. If we're not getting enough sleep, our body can't do those basic processes. Improving sleep also leads to better mental health. There's plenty of studies in that. I remember a few years ago, the psychiatric journals started talking about how important sleep was for anxiety and depression. And I remember kind of hitting my head and said, they're just starting to talk about this now as if it's something new, Like, it makes common sense. I think so much in the medicine we're talking about today is really common sense medicine. Yes, we have studies and mechanisms, and that's wonderful, but basic common sense, the stuff that our grandmothers knew generations ago, really apply. So what about movement? Has anyone been to New York City? So this is 7th Avenue in New York City. This is a new staircase that just went up. And so this goes from Penn Station, which is in the ground, up to 7th Avenue. My office is over there somewhere. And if you look at this, what do you notice? This is just a random moment. About 20, 25 people are taking the escalator. We got one guy taking the steps and one guy thinking about it. And this is very common. Ask yourself. I'm not going to ask people to raise hands. Do you take the steps or do you take the escalator? So, and I guarantee you, if we did an exit research poll up here, the people taking the steps are healthier people, probably have lower blood pressure, probably a better metabolism, more lean body mass. It's such an easy thing to do, is to just take the steps. And if you go to 9th Avenue, the steps that come down from 9th Avenue, people don't even take the steps going down. So, and this isn't a judgment. This is the world we live in. We've created a situation where we just create all this ease because we don't like discomfort. We don't like to exercise because it doesn't feel comfortable. But discomfort is actually what's going to keep us healthier in this case. So we have to kind of move past that and start to move our bodies some more. If you look at the study from Copenhagen a few years ago, what's been shown is that moderate exercise, not a lot of exercise, very moderate, look at these benefits. 6.2 years for men, 5.6 years for women. What drug increases your life expectancy 6.2 years? And it's not a lot of exercise. 1 to 2.5 hours, moderate. In fact, if you start doing more, the benefits go away. So very mild to moderate exercise, not a lot of movement at all. 5.6 to 6.2 years. If there was a drug that had no side effects and guaranteed you'd live 5 to 6 years longer, would you take it? I would buy it. What a blockbuster drug that would be. In the meantime, was this in the news? I didn't see this in the news. This is amazing information to me. So globally, 8.8 million people a year die because of pollution. Right? How many people died from COVID? Between 7 and 8 million a year. 7 and 8 million globally. That's how many people die each year from pollution. We made such a big deal about COVID, which of course there's reasons for that, but we're not talking about this. Loss of life expectancy per person is 2.9, almost 3 years per person. So each one of us isn't going to live 3 years longer because of this. There's actually in the marketplace a really fine air filter out there called IQ Air. I keep it in my bedroom because the northeast of the United States is not clean air. And I think it's important that at least where we sleep, we should have the cleanest air possible. Air pollution is associated with risk of depression symptoms and suicidal behaviors. And I believe as time goes along, we're going to find that these chemicals, which I call psychiatrogens, are probably very toxic to the brain and are a leading cause of mood disorder as well as death. So I think a lot of studies still need to be done, but I believe environmental pollution has a lot to do with the mental health problems we're seeing today as well. Okay, getting out in nature is really important. When kids get out in nature when they're young, they have far less psychiatric problems as an adult. So whether you're an adult or a child, we need to get outside. Our bodies are made to be outside. It calms our bodies when we're outside. What about a dog? So this is my dog, Elon, who's back in New York right now, and I miss him. So Elon is great because he's given me a 24% lower risk of dying, right? There's studies that show that dogs reduce cortisol levels. There's also studies that show that dogs, when they lick you, they improve your microbiome. So get a dog, get in the dirt with the dog, let the dog lick you, do it outside, right? Okay, so education, also very important. It's been shown that when kids are educated at a young age, the higher the education, the longer the person lives. So I've tried to find things that my patients like to do. Do they like to read the newspaper? I put this picture up because I bought tablas. I'm a drummer. I bought tablas about 10 years ago. I still haven't learned how to use them. But I'm going to take lessons. And being here has absolutely inspired me. And one of the reasons I want to do it is because it'll help me live longer. So what about water? Water's so basic, right? And when we're hydrated, there's also less depression and anxiety. When we're hydrated, tryptophan gets made into serotonin in the brain, which gets made into melatonin at a much higher level. So it's important to hydrate. One of these was talked about today, maybe both of them. Caloric restriction, very important, both for blood sugar regulation, mood. When we eat too much, our mood goes south. There's a lot of studies on that. And the other thing is advanced glycation end products, which is basically cooking your food at a higher temperature. It creates these ages, 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 which inflame our body, and it also reduces longevity as well. So that's why when you bake something, it's healthier than frying it. And if you boil something, it's healthier than baking it. Probably one of the healthiest diets, if I don't know someone and they say, hey, what diet should I eat? I'd probably recommend some version of the Mediterranean-style diet. The people who live the longest in the blue zones typically eat some version of the Mediterranean-style diet. We were talking about coffee earlier. There's a 12% lower risk of dying from people who drink coffee. And in terms of depression, it's shown that drinking 2 to 4 cups of coffee lowered the risk of depression 15 to 20%, but 8 cups of coffee a day can actually increase suicide. So there's a U-shaped curve there, right? When you have too much, it's no good either. Like everything. Too little water, you dehydrate. Too much water, you drown. It's the same with a lot of things, even healthy things. While we're eating that healthy diet, we want to make sure we eat enough protein, especially as we get older. Protein's made into amino acids, right? Amino acids are made into neurotransmitters, which help your mood. So, and look at these numbers. I thought this was fascinating. People who replace just 3% of red meat with plant protein, not much. Look at these numbers, 34 to almost 40% less likely to die of any cause of cancer or of heart disease. Pretty significant numbers, just a small change. You know, that's what, like I don't know, 1 serving of beans instead of a meat, maybe once a week. It's not a lot, but pretty amazing results. And what about supplements? Supplements are great. They don't replace food. And I think if we just focus on supplements, we're not going to fix problems either. But if we use supplements strategically, they can absolutely help. So there are so many to choose from. I picked 3. Vitamin D, probiotics, and curcumin. So vitamin D has been shown to improve longevity. We talked about the importance in telomeres before, also for lowering cancer, lowering cardiovascular disease, and increasing longevity. And of course, vitamin D, it's called a happy vitamin. It's been shown to be very important for mood, for both anxiety and depression, as well as schizophrenia, bipolar disorder, autism, ADHD as well. Studies on all of those, very strong studies. Fermented foods, right? Taking care of your good gut bacteria has been shown in mice to enhance lifespan, and we know clinical studies in people that were done in France show that you'll increase levels of GABA, which is your calming neurotransmitter in your brain. So what are the foods that have GABA? The foods that have probiotics? Dokla, kefir, chutneys, pickle, natto, kimchi, yogurt, miso. So basically all the fermented foods, as many as we can get in. And then finally, curry. Here's an interesting study, curcumin-rich curry consumption and life expectancy. So what they found that people who did an occasional consumption of curry had lowered cardiovascular disease rates of mortality by almost 40% and an increased life expectancy by 1 year. That's occasional consumption, so not much, right? Now we know that curcumin is the active substance that they process from turmeric. So typically, if we're going to use it therapeutically, we'll use curcumin instead of turmeric. And then here's a review from 2021 looking at the antidepressant effects of curcumin. There are studies using curcumin head-to-head with SSRI antidepressants showing just as much benefit without the side effects. So good for longevity, good for mood. Okay, so here's our summary. Mental health affects longevity. That seems to be clear. The underlying causes, high stress hormones, inflammation, DNA damage seem to be the main ones, and then there's a number of other ones that we talked about as well. And that we can also fix this. We can fix this. But drugs aren't the answer. Drugs might help in the short term, might get us out of a tough situation, but we can't rely on them, and we can't keep people on them. There's too many side effects. What are the answers? Good sleep, adequate movement, nature and animals, learning, hydration, food, and the right supplements. And I didn't discuss psychotherapy, relaxation work, vagal nerve stimulation as well. Those, I think, are very important, and I usually bring those into a plan with my patients. And I really do ask them the question, what makes you happy? Like, what's going on with your spirit, and what do we need to work on there? Okay, thank you so much. It was a pleasure to be here.